in Britain, it's supposedly Freedom Day tomorrow. But as we were saying, they've had 300,000 cases in the last week alone. They have the NHS there, which is their precious kind of socialist health system. There's one argument they've put forward, which is quite a disturbing one, Rita and James, that they would rather have Freedom Day now that it's summer and have people get infected now in the summer, because in winter it's going to be far too hard. And wait for it, the culprit in winter will be the common cold. And this is really disturbing, James. They are now saying Britain's Academy of Medical Science is now warning that up to 60,000 Brits could die this winter due to the cold, the common cold, the flu, because of, wait for it, a huge drop in natural immunity caused by the COVID lockdowns. James.
I mean, Rowan, who would have seen this coming? You know, we have been talking about this for over a year now on this show, and one of the things that I've always said with things, you know, like these, you've got this big bulge of deaths in the population in COVID, and then it's sort of like trying to hold a beach ball underwater in a pool. You know, you push them down over here, but then boom, they pop up over there. And that's exactly what we're seeing in the UK. We're seeing it in New Zealand now, where there is a sudden rise, and tragically among very young people, and including infants, in what were previously really, really rare respiratory diseases. You know, everybody out there who's got kids knows one of the things is you've got to let kids play in the dirt, because that's how they build up their natural immunity. And if you don't do that, you know, you wind up with sick kids. It's that paradox. The same thing is happening on a society-wide level, but this is just yet another case where Rowan and Rita, in the effort to keep this one number down at zero COVID, they've created all of this death, destruction, misery, and this long tail of respiratory diseases, which we're going to see now, going on all through next Northern Hemisphere winter, all because, you know, they decided to jam everybody's immunity down to zero in an effort to reduce the deaths from one particular respiratory disease. It's madness.
Well,
only experts could do it so wrong.
Let's be really clear here. This is what Scott Morrison, Josh Frydenberg, Gladys Berejiklian, Daniel Andrews, and all the rest, you guys are responsible for what is called immunity debt or deficit. This is the idea that people are not getting natural immunity for normal things like the cold, the flu, whatever it might be, because of your lockdowns. You are responsible for this. Know that you are. We've got our eye on you, and we're going to keep reminding you. Every day you lock us down, you are creating health hazards for people, and particular for kids. Be it on your heads. In New Zealand, for example, Rita, in hospitals, they're experiencing this immunity debt where they're seeing kids with potentially deadly respiratory diseases caused by lockdown. You guys are responsible. Rita.
Yes, the New Zealand story, I think, is a scary warning. In Wellington alone, there's 46 children in hospital, a lot of them on oxygen with these respiratory illnesses because of that immunity debt that you mentioned. You mentioned the politicians there. You're absolutely right. The power rests with them, but they have relinquished all their power to these unelected, unaccountable public health bureaucrats. Every decision, every wrong decision, from the vaccine rollout being delayed to the it's not a race nonsense, all of that came from the public health bureaucracy. Remember, it was Dr. Brendan Murphy who first said it's not a race for the vaccine rollout, and then Scott Morrison echoed those sentiments. They have absolutely given up their power, and they are just being laser focused on one virus instead of looking at all the consequences of their actions, all the health consequences, all the societal consequences, the economic consequences. It is unbelievable, but it is across the board. Labor, Liberal, and the opposition, whether we're talking about the federal opposition or the state oppositions, they have been just as weak and gutless. They have not been willing to put forward an opposing view. They have not been willing to challenge some of these very unscientific, crippling restrictions. So we've got this monoculture, I guess. It's
Yep.
where everybody
Absolutely.
is afflicted with groupthink. And when we've got someone like Dr. Martin Kulldorff, the Harvard Medical School professor, who comes on Sky News and says things like public health is supposed to be about the totality of your response, or how you impact everybody, and lockdowns are destructive for these reasons. And he explains his position from a point of view of an infectious diseases expert, one of the most well-credentialed ones in the world. People are shocked. They're like, how dare he say that? How can he say that?
Wow.
Because all they hear is this single narrative. And Australians, 16, 17 months into this pandemic, so many are really ill-informed about the risks of COVID, how it will impact different age groups, because they've just been scared silly. We still think it's the Black Death. Yeah, this is a very dangerous virus for people who are very old, very sick, very fat. It can be deadly. I'm not saying it's not a very dangerous virus. Let's be clear. But Australians overstate the risk by an enormous factor if you look at some of the polling, because they don't get the full picture. All we get is this relentless scaremongering.
Exactly, and there's this obscene pornographic focus on the case numbers every day, which bears no relationship to the deaths, as Rita pointed out. Delta virus is far more infectious, but far less deadly. We're never told that.